probably have swelling. Pain increases with respiration, shortness of breath. Return to play is going to be 6 to 12 weeks, depending upon pain. And then crepitus is typical with most fractures, with most bone breaks. Flailed chest. This is where we start getting medical emergency time. So we're talking about the involvement of 4 to 5 ribs, where you've broken them in 2 places. So instead of just having a crack along one of the curved ribs, you've managed to like displace a whole section of ribs, to where when you breathe in, that negative pressure, that vacuum that we have that helps draw air in, actually ends up drawing in a whole chunk and section of ribs. So this is like you've now displaced a rack of ribs from your own set of ribs. And this is going to create some pretty big issues. So you'll see over here, we've got a fracture sites that are both posterior as well as this anterior set. So now we have a whole section of ribs that are disconnected from the rest of the body. So when you try to open up your rib cage to breathe, it just draws this inward, which is going to impact our lungs in our breathing. High velocity blood impact to ribs. There's chest pain, chest wall deformity, labor, breathing. Chest wall tenderness, and again we've got fractures. Fendings maybe delayed 10 days after injury. So you may have that pain, but that whole flailed chest where it's actually drawing inward doesn't really become obvious for a week, week and a half afterwards. Concerns pneumothorax and hemothorax occur in over 70% of these people. So we've damaged internally the pleura internal to where the air and the blood is going to start filling up that thoracic cavity, which is going to start causing respiratory distress. Pulmonary contusion is common. Again, this is such a high force blood trauma that you're messing up a lot of stuff all at one time. Management, maintain airway, monitor vitals. Now here you want a pillow placed over the flail chest area, which may help reduce the pain and ease of breathing. So it's not letting those pieces shift around quite so much, so it just makes it a little more comfortable. And then transport to EMS. Return to contact sports in about 3 months, but it takes a good 8 weeks for this to heal. So this is one of those bigger deals. But again, it's also such a unique piece. There's very few sports this should happen in. Spleen injury. For the most part, we can survive a spleen injury as long as we get medical care. They used to take them out as soon as they ruptured, so you've got an organ that's about the thickness of a plastic baggie. It's really not very thick, and it holds a whole lot of blood. And so if you go and pop that little bad boy, then a lot of that blood that cycles through it is going to split in the abdominal cavity. Now, what does the spleen do?
What's the biggest lymph present?
Huh?
The biggest lymph?
Biggest lymph.
Yeah.
Finish the word.
Lymphatic?
Lymphatic
Yeah.
organ. So it's the largest lymphatic organ, so there's a lot of your cleaning process that goes through it. Name a disease, an illness that we get concerns about. Mono. Why does mono?
Because if your spleen hangs on the blood and if you're in a contact split, then it bursts really easily.
So your spleen is what's in charge of going normal, 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 abnormal. We got to kick you out of the gene pool. Normal, normal. So it regulates old blood cells. It regulates used blood cells. It regulates disformed blood cells. It's the one that pulls them out of circulation so they can recycle them and use them elsewhere. It takes the hemoglobin, sends that over to the liver. That's where we end up making bilirubin out of, which is, well, bilirubin, and ultimately making bile. So your body recycles all of these components. In the case of mono, we have an issue in which it damages, it distorts the shape of the cell. So your spleen is looking at every one going abnormal, 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 has to pull all of these out. So because it's doing so much more work and taking out so many more cells, it enlarges in size. So as it gets bigger, well, it becomes palpable, which normally it is not. So that doctor's going to start pushing up under your stomach because it kind of sits behind it a little bit. And if he can feel it, then that's not a good sign because that means it is larger. And if you have a sudden movement or get hit, then you can rupture your spleen. So we hold you out for at least a month post-illness to make sure that it goes down and is normal again. You'll typically have abdominal guarding, pain upper left quadrant up through here, through the left shoulder, which is the Kerr sign, so you get pain referred up in here from the spleen injury. And then there's a pretty picture. As it ruptures and bleeds out, it kind of fills in all the spaces around it. Yeah, lovely. Lightheadedness, malaise, fatigue, all these kind of things you expect to see from low blood volume, from bleeding out internally. Physical findings, point tenderness on the ribs overlying the spleen, tenderness in the left abdomen, abdominal rigidity, hypotension, and then tachycardia. So as your blood pressure is dropping out, you're basically going into hypovolemic shock, and that can kill you. It's bad for your health. Good morning, how are you? Management, follow CPR protocols, so maintain airway, breathing, circulation, make sure they're doing okay. You want EMS transport. They're going to drop a very large bore IV needle in this person's arm. They're going to give them bags and bags and bags of IV to hold on to them to keep the volume high enough. The spleen will ultimately fix itself. It should clot and stop the bleeding to where it can get settled. So as long as we can keep you with enough fluid and hemoglobin, we're going to be okay. And they'll check you for every 6 hours for up to 24 hours. Return to play 6 weeks, possible with CT clearance. 2 to 3 months of surgery was required. So as long as we can get through that initial emergency stage, we can get you to the hospital, they can hold on, and we can be okay. If not, the risk of bleeding out is pretty severe. So get them emergency care quickly. Kidney trauma, blood trauma over the kidney area, abdominal pain, flank pain, anything down in this lower back area. If you have a suspect, if you have an injury to that area, then there's a good chance that they're going to have some symptoms. So what does your kidneys do?
Filter blood.
Filter the blood. So they pull out the urine, they concentrate it, they make sure that the exact electrochemical balances are present, the pH is just right, the water content is just right. And so if we go and tick them off, and then we start having issues. So one of the issues we can see, one of the first things that we can identify is that if this person's got obvious blood in the urine, there's a problem. So asking them if they've got injury there, if they go potty, be like, look at it, because if you're seeing blood in your pee, that's not a good sign. We need to get it assessed, make sure that we maintain function. Because of the risk of contact in these areas, people who have one organ, one kidney, are typically advised not to play contact sports, because if you do have a traumatic injury to one, well, if that's your only one, then we have a little bit more of an issue. Pain with trunk rotation, costovertebral angle tenderness, I mean pretty much anything down in this region, abdominal mass, urinalysis revealing gross or microscopic hematuria, which is blood in the urine. Right kidney injury coexists with liver injury about 40% of the time. So if it's a hard enough injury on the right-hand side, damage to the kidney, about 40% chance that there's going to impact the liver as well. So getting them assessed is going to be important. Monitor ABCs, and if hypotensive or tachycardia, then use Trendelenburg position, which is head down, feet up, so kind of like on decline plane, which is supposed to help preserve blood pressure in the abdominal region and around your organs. EMS transport may be indicated if it's bad enough. So abdominal sports hernia, pain in lower abdominal, medial inguinal, and pubic regions. This is a kind of a tear in the musculature, so it's kind of a non-specific. It can be any of the muscles in there. It can be somewhat difficult to identify simply because it's fairly non-specific in what it is regarding which muscle is torn. But anytime you have a tear that's got that possibility for things to slip through, you've got issues. Symptoms aggravated by sudden propulsive movements such as kicking that you won't see much out of the ordinary. Functional status, pain and tenderness with resisted sit-ups, anything that would trigger those muscles to fire. Palpable gap over the external oblique and dilated external ring, absence of hernia bulge. So you're pretty much just getting a tear up in one of these internal muscles. So patients who do not respond to conservative treatment after 8 weeks are surgical candidates. Otherwise, and it's about 16 weeks for RTP for surgical cases. So if we can get them fixed without surgery, better. Most of it is just going to be relaxed, conservative treatment with therapy. So inguinal hernia. Pain may be described as arising from inguinal canal, through pain, although pain may not be described by all patients. They're going to have, typically in the inguinal region along the inguinal canal, you'll feel a little bit of a bulge. And that bulge is pressure from the small intestines pushing through that hole, which is going to be a problem. So the inguinal canal, what goes through that canal?
Right.
The navy, right? The femoral navy, nerve, artery, and vein. NAV, good. So navy, so nerve, artery, and vein. If that hole enlarges and the small intestine starts slipping through, then we've got it can definitely cause a physical, if palpable bulge, if not visible bulge, over the inguinal ligament. It's going to be quite uncomfortable, and the bulge increases with exertion and reduces with relaxation and recumbency. And then we can end up getting a loop of the intestine popping through it, which if this twists or gets impinged, then this is going to lose its blood supply and die.